Blood cultures are an essential aid in detecting the causes of bloodstream infections, as well as those of infective endocarditis. Specimen collection is the first step. A blood specimen needs to be collected from the patient aseptically. Skin preparation. It involves locating the desired vein by palpation, thoroughly cleansing the skin with an alcohol swab, then letting the area air dry before performing the venipuncture. Important, avoid repalpating the vein after you have cleaned the area. Before introducing the blood that you drew from the patient into the blood culture bottles, you need to ensure that the sensor at the bottom of the bottle is intact. If the sensor is not intact, discard the bottle. If all is good, remove the protective flip-top overcap from the blood culture bottle and then disinfect the septum with 70% alcohol. Please note, it is important to clean the skin thoroughly before venipuncture because the skin harbors normal flora, which can potentially contaminate blood cultures. Now that you understand the process of collecting blood cultures, the next question arises. When should blood cultures be taken from a patient suspected of having a bloodstream infection? How do you determine the timing for sampling? The following factors should be considered. Collect blood cultures promptly after the onset of clinical symptoms, ideally before starting antimicrobial treatment. If the patient is already receiving antimicrobial therapy, increase the chances of identifying microorganisms by taking the blood sample just before the next dose and inoculating it into bottles with specific antimicrobial neutralization media. Some sources recommend sampling during fever spikes, with a 30 to 60-minute gap between samples. However, other studies have not identified an ideal time for blood culture collection based on body temperature. What is the optimal number of blood cultures needed for testing? The number of blood cultures required for a febrile patient depends on factors like the suspected diagnosis, clinical condition, likelihood of underlying infection, and urgency for treatment. One blood culture is hardly ever enough or recommended. It is challenging to interpret a positive outcome from a single culture unless a clear pathogen is identified. 2 blood culture sets are usually sufficient for cases where ongoing bacteremia is expected. 3 blood culture sets are appropriate when there is suspicion of intermittent bacteremia. It is seldom necessary to have more than 3 blood cultures in settings with limited resources. The volume of blood to be taken for culture. To ensure accurate blood culture results, the following should be kept in mind. Adults should have a minimum of 10 milliliters, preferably 20 mL, of blood collected, while infants and children should have 1 to 5 milliliters, preferably more, taken. The blood culture's effectiveness is influenced by the volume of blood collected, with adults seeing a 3% increase in yield per milliliter of blood cultured. It is crucial to maintain the correct blood-to-culture medium ratio. Most blood culture bottles include the anticoagulant sodium polyanethol sulfonate, SPS, which can impact certain substances but also be harmful to specific organisms. Adding adequate blood to the bottle can counteract this negative effect. Experts recommend a blood dilution in broth at a ratio of 1:5. Type of blood culture bottle. The bottles hold broth enhanced with additives. Some bottles are tailored for specific patient groups, while others are meant to isolate distinct classes of pathogens. Standard aerobic bottles are effective in detecting common bacterial pathogens, such as aerobes and facultative anaerobes. However, they may not be ideal for cultivating strict anaerobes. It has been conventionally recommended to use a combination of aerobic and anaerobic bottles for blood cultures. The necessity of routinely using anaerobic bottles has come into question, as the occurrence of anaerobic bacteremia is on the decline. In most cases, infections related to anaerobic bacteria are clinically suspected, and suitable empirical treatment is initiated prior to receiving blood culture results. On the other hand, studies have shown an enhanced microbial detection rate when utilizing paired aerobic-anaerobic blood cultures. Certain manufacturers create aerobic and anaerobic bottles with additives, like charcoal or resins, that neutralize antibiotics. These are recommended for drawing blood cultures from patients receiving antimicrobials, despite being pricier. Research suggests that these bottles have a shorter average time to positivity compared to regular aerobic and anaerobic bottles, but their cost-effectiveness remains uncertain. Pediatric bottles commonly contain growth factors and additives that bind antibiotics, enhancing the retrieval of bacteria. Mycobacterial blood culture bottles contain a broth suitable for mycobacteria isolation, aiding in detecting disseminated mycobacterial infections like M. tuberculosis and non-tuberculous mycobacteria. While these bottles can also assist in recovering yeast from blood, there is limited evidence supporting this use. Due to the added cost, standard blood culture bottles are recommended for candidemia detection, reserving mycobacterial blood cultures for suspected mycobacterial infections. Thank you for tuning in. I trust you found this video enjoyable. Stay tuned for the next video where I'll delve into the processing of blood culture specimens in the laboratory.